Hi, Dr. Erickson again. Today, as we talk about ADD and ADHD, I want to go over the normal progression of a brain as it's developing. This is a huge component that is often overlooked by other doctors and other therapists. Developmental benchmarks that your child should experience is that at about the age of 3 months, your child should have rolled over. At about the age of 6 months, he or she should have begun crawling. And around 12 months, he should have begun walking. Now, there's a fudge factor here of give or take a month before or after. But these are developmental benchmarks that if your child has missed these, there could be an indication that there is an underlying underdevelopment of the neurological part of his body. Your brainstem, which is the base of the brain, the brainstem has several reflexes. We call them primitive reflexes. They're survival mechanisms that are in place up until your child is 6 months of age. At the age of 6 months, the rest of the brain should have developed to the point that it can override these primitive survival mechanisms and replace them with more sophisticated current reflexes and adaptations that will serve your child as he or she gets older. Now, the reason that these things are overcome, or the reason that the higher parts of the brain can override them, is they have developed through a process called myelination to a point that now they can override those primitive reflexes with their own. Myelination in the body, the development of the brain, is actually accomplished through motion and movement. So if your child is moving properly, and we talked about those developmental benchmarks just a few moments ago, if your child is developing properly, learning how to roll over, learning how to crawl, learning how to walk in the appropriate time and fashion, then you're having a brain that is going to develop along proper timeline. If they are not developing along those time frames, or if they're moving improperly, that is an indication not that your child is really cute, that he drags one leg along as he's crawling, but that there may be a lag in the development of the higher centers of the brain. Sometimes we have parents who talk about, and they're very proud about the fact that my child went from rolling around on the ground to walking, basically skipped the crawling phase. That's not always such a good thing when we look at things developmentally, because the brain needs that particular response and stimulation and develop to fully come into its own. Now, some other developmental progressions that need to take place within the brain. The cerebellum has several different areas. There's a medial or a middle part of the cerebellum, an intermediate part, and then a lateral part. The middle part has several brain or several cell nuclei. Nuclei are like little brain centers within the cerebellum itself. The one inside the middle nuclei is called the fastigial nucleus. Now, some of the terminology I'm going to use you may be unfamiliar with, but you can replay the video again until you get the gist of what I'm saying. But listen for the cause and the application as it applies to your child's development. So the fastigial nucleus actually has a huge influence on the development and the execution of movements in the spine and the eyes. Now, the intermediate nuclei are called the globose and emboliform nuclei. They're in charge of administrating control over the proximal joints, which would be like the shoulders and the elbows, or the hips and the knees. Now, the lateral nuclei are the last to develop. They're called, or the nuclei are called the dentate nucleus. And what they control, very important here, and slightly different and in addition to the others, is they do control fingers and toes, but they also have a huge role in cognition, word association, mental imagery of movement, practice-related learning, error detection, judging time intervals. The lateral part of the cerebellum has a huge influence in helping to guide and direct the development of the frontal lobes, which sit in the front of the brain. That is where personality resides. Many children who have ADD and ADHD have an imbalance in their frontal lobes. What happens, though, is that a proper development of the cerebellum from medial to intermediate to lateral will support the healthy formation and development of the frontal lobes. And remember, it's the frontal lobe that inhibits these primitive reflexes. So if your child is assessed by the primitive reflexes and still has them at the age of 8, we know that developmentally, part of his development in the brain is stuck at the midbrain. The frontal brain has not developed to the point that it is able to override those. Now, mistakenly what happens is that therapists will jump in and either do brain mapping, or they will jump in and immediately try to stimulate the higher areas of the brain, the frontal lobe. They may use speech therapy. They may use reading therapy. They may use activities or balances or other types of activities to try to stimulate higher brain functions. The problem here is that if we have jumped over early developmental phases, if we have jumped over and are ignorant of the fact that primitive reflexes still exist, our efforts at rehabilitating your child and getting him back into a functioning unit of society are going to be severely hampered. The primitive reflexes have to be remediated first. We have to go back and get those primitive reflexes suppressed and follow the chronological development that should have taken place in your child's brain to get to the point where now that frontal lobe can be developed in a fashion that will yield results. The end result of this method, and by not skipping this step, is that speech will improve more quickly, balance and coordination will improve, attention span can improve, coordination, muscle tone, all of these things will improve because we have followed through the natural order of things. Now, why don't other doctors and therapists recognize this? I'm not sure. It is in the literature. It is something that I am aware of and I deal with the kids that we help. Dr. John Erickson here saying, I hope you enjoyed this short discussion on the progression and development of your child's brain as it relates to ADD and ADHD. Have a great day.